Well, thanks, Norm. That's a great keynote. Thanks for joining us here at the Mental Health and Law Conference. I'm Jason Renaud, and I've got some questions for you, and I think members of our audience also have some questions. So thanks again for doing this.
Sure, my pleasure.
Norm, I just start off with maybe a personal question is could you speak a little bit more about the family experience of this terrible illness and how did Matthew's illness affect your family?
The strains were enormous. And, frankly, when we started with this, we didn't know anything much about it. We were naive. And once we saw Matthew going through this trauma, I had the naive belief that if only we could get him on medication, that it would be like a switch that would enable him to understand what was going on and then be willing to do something more for himself. I didn't realize, among other things, that the medications that are out there are imperfect, to say the least. That even for those who really want treatment, it can take months to find the right combination. The story that I mentioned, I would say, Jason, of this young man in New York, multiple medications didn't work for him, and then Seroquel apparently did, and he was great for a while, but then it stopped working. And we know that medication is often a necessary part of treatment for a serious mental illness, but it's not the only thing. And of course, I tried to deal with logic with my son. He was a national champion debater, as I mentioned, and he could counter everything that I said. He had his own firm views on this. When we tried to get him treatment, we were stymied at every turn, and that includes, by the way, not just instances where he might have been hospitalized, where the hospital refused to even tell us whether he was there, but it was also not just HIPAA, which provides privacy for patients, but frankly, doctors, hospitals, and others misusing HIPAA for their own convenience, misstating what's there. It's actually it provides more opportunities than most allow. But we also didn't know what to do. And frankly, I'll tell you a couple of things about this. We had no idea that NAMI existed.
Yeah.
And I will tell you that my family is situated most. We have resources. We have been in Washington, D.C. for a long time. I know the most powerful people in the world. I have connections everywhere. We got fantastic psychiatrists to help, but we didn't know what resources were available to families. NAMI, which is the largest umbrella organization, has family and peer-to-peer counseling. We just didn't know anything about it, and nobody told us about it. I will give you one very tragic story here, Jason. I was able to find a remarkable psychiatrist in Fenton. Wayne was at the National Institutes of Health, NIMH, but he took a small number of patients at night because he was so dedicated to dealing with these issues. He would come to our house. Our son had been in LA. He came back to Washington. He had depression along with his psychosis because he didn't know why God had taken his soul. He was on a journey. And he went up to his childhood bedroom and basically stayed there. Dr. Fenton would come to the house at 10 o'clock. Our son would yell down, I'm not seeing him. I'm not talking to anybody. Wayne would march up to his room and they would talk for 2 hours. And while it wasn't providing a remarkable turnaround, a relationship was developing, something that might well have led to something better. About 9 months into all of this, Wayne Fenton murdered, not by one of his own patients, another doctor's patient, a 19-year-old, deeply schizophrenic young man, a Russian immigrant, a twin, his twin brother, perfectly fine, off his meds. And this doctor called Wayne Fenton because he knew that he was the go-to guy for serious mental illness and said, I need help. over the Labor Day weekend, Wayne said, "I'll see him at on Saturday," abandoned his family picnic, went to an office that a physician friend of his enabled him to use, came with his father. The father, he said, walk around the block, come back in 10 minutes. He came back to find that Wayne had been beaten to death by this young man, caught up deeply in his psychosis. It was a traumatic beyond belief. Our son, who had not gotten out of his bed, didn't tell us, but he put on a suit and actually went to the funeral. I think in his own mind, he had been the cause of this, that God had punished him even further. And a year later, the young man who had done this, who had been put into a psychiatric facility for competency restoration in the state of Maryland, did not allow forced medication for somebody unless they were an imminent threat to themselves or others, meaning almost literally, you had to put a gun to your head or a knife to somebody else's throat. And I fell off the chair in my breakfast room as I read in the Washington Post that this young man had killed his roommate in that hospital. So tragedy upon tragedy because of misguided policies and because we just are unable to deal with these things. That was the end of anybody who our son would be willing to see. And we tried everything. We tried tough love. We tried taking resources away from him. We tried finding places for him to live, and he got booted out of places. And we, at one point, on the recommendation, the pernicious recommendation of somebody who managed a condominium in Florida where we had been able to put him, use the Baker Act to have him put for 72 hours for observation, which was incredibly traumatic for him. He was basically snatched out of his the place where he was living, having just come out of the shower in his underwear, where he was preparing to go to a Friday night religious service, Shabbat service. And the 72 hours, of course, did nothing for him except make it even worse and more traumatic. And we got nowhere. And as a family, there's guilt, there is frustration, there is horror, there is unmeasurable grief that comes with it. And I should add, our other son, who suffered the loss of his only son and had to go through another kind of trauma. Sibling grief is just not treated the same way as parental grief. People would say to him, "Sorry for your loss, how are your parents?" Or "You're all they have." This is the common experience. And we have to find better ways of dealing with family trauma from this kind of terrible, terrible thing. And we have to come to recognize, tell you one other element here, Jason. I'm sorry to go on for so long. Our friends, highly educated, sophisticated people. I can't tell you how many of them said to us as we were going through this, "Why don't you just kick him in the ass?" As if this were something that was willful on his part. It is a
Behavioral.
brain disease. It's like saying to somebody with pancreatic cancer, "Why don't you just kick him ass to deal with this issue?" And we used to refer to this as stage 4 brain disease. And the recognizes that these are not illnesses where people do it because they want to, but it is the disease of an organ like any other organ, that we have to treat them as we do other diseases. We're not as far as we need to deal with these issues.
Norma, I'm so sorry for your family, and you've seen many condolences for your family and for yourself in the chat. But I do want to ask, and it sort of jumped to maybe you're a good talk going on this. There's a philosophical split between patient rights and family experience, and you're speaking the family experience of almost every NAMI member. This is a club no one wants to.
Yep. And
how do we reconcile these two very different perspectives, very different legal statuses, very different social statuses. How do we reconcile this?
And I will tell you, Jason, that we have divisions within our own family. Our son Danny is adamantly against forced treatment. He, believes in civil liberties. I recognize that forced treatment and it might not work. And you can force getting people into facilities where they're often booted out after 70 years, or there are no professionals to them, or you don't have insurance, so that's it for you. You're out of there. I recognize as well that forcing treatment on people can be even more traumatic and might result in something like alienation from family members. But there's something else that is crystal clear to me, and that is that if you decide that everybody with a serious mental illness has agency, is doing what they want because they know what they want, I simply do not believe that there are people who say, I want to be out there homeless and free a bridge. I want to be out there and face the possibility of having somebody on the streets beat the crap out of me or beat me to death, or have a police officer come and escalate the conflict and or shoot me. People don't make those decisions. What this Council of State Courts, and my wife was a part of a group to try and come up with a better standard. What stand is that if you have somebody who has no awareness of their illness, who is incapable of making decisions about what's for them, you have to strike a better balance, and that balance has to include safety to make this person not abused. And we also have to put more resources into getting better treatment for people. But you can't just step back and wash yourself out of the problems that exist and say, hey, let them do whatever they want, because you're going to lead to even more tragedies, more homelessness, more unnecessary deaths. We have to find a better balance, and we have to change the dialogue and the way we deal with these things. And I would add one other thing, Jason, which is what I've discovered, what's become clear, is it's going to be hard to find a family in this country that hasn't experienced some kind of mental illness, tragedy, or difficulty in their own family lives, friends and family. But somehow, I think in part because of the stigma that exists there, when I look with this, which was difficult to do, you don't want to talk about your own family's issues. The number of people who contacted us in our family, contacted me and said, I've never told anybody this, but, and it may have been the suicide of a parent or a family member, or it may be people who feel like they're alone because they have children with the same kinds of issues that Matthew had, and they don't know what to do, and they don't know that there were others who went through the same thing until you tell them about it. You look at other diseases that have small numbers of people and families involved, and we put massive resources into dealing with them. And we have not united as a community that includes almost everybody to deal with these issues of serious mental illness. If we diverted a quarter of what we're putting into incarceration into more beds, more training, more professionals, we would have a dramatic reduction in what's going on. If we focus more on how we can have assisted outpatient treatment and create a better balance for people so that they're not incarcerated, but we know that they're getting some of the treatment that they need, we would have fewer tragedies in this process. So we've got a lot of work to do to make sure that we unite this community and demand the changes that are needed.
So Norm, I salute your courage and bravery and willing to put yourself forward and speak about these things. I think that's so important, especially when someone like yourself has a powerful public voice to come forward and speak up. Tell me a little bit, we've got just a few minutes, tell me a little bit about the public side of what you've done. You've created a foundation in your son's name.
have, and we've taken on two tasks. One is to try and change the mental health system. It's the Matthew Harris Ornstein Memorial Foundation. You can go Ornstein, MORNSTEIN.org to see what we're doing. The other, which is very gratifying, is to honor our son's experience, which was the best part of him and his life, which was debate. He found this community in debate, and his debate partner, a wonderful man named Alex Berger, who's a successful screenwriter and producer, and went out to Hollywood with our son Matthew, his very best friend, suggested that we create a summer debate camp for public school kids. The Washington, D.C. area, there are urban debate chapters across the country. You know, when Matthew debated, he was at a private, and he did this, and the national debate circuit was consistent elite private schools and a small number of elite and well-financed public schools. For most kids in public schools, they don't have the ability, the resources to do this. So we have a 3-week camp now. We started with 30 first year after Matthew died 10 years ago. We're now going to have over 270 likely through high school. 3 weeks for varsity kids, 2 weeks for junior varsity and novices. And then they go out and form teams in their own schools. We have over 80 schools involved now, and we're going to have over 270 kids. We give them free breakfast, lunch, everything is free, and they learn life skills. And it's a kind of escalator up to success. And it improves their performance in school and in laughter. Colleges flock to us because they know that kids who've taken debate know how to speak in front of others, know how to do research, know a lot of, because the debate here, they're not fazed by anything, not intimidated by anybody, and they are going to lead in college. And Matthew would have loved that. And to be frank, would have hated anything that we do in the mental illness area because he didn't believe there was such a thing. He didn't have it, and it was a construct of society to keep people within conventional boundaries, compelled to do something because we didn't want others to go through the trauma that we went through. You know, there are many others who are doing comparable things or doing even more. We've been fortunate that some resources and we get more. We were able to do this film and to take it around the country. And we also had a public platform, was able to get in the New York Times 9 months after Matthew's tragedy. Members of Congress came to me and said that the first comprehensive mental health policy Congress was foundering in the House, issues on both sides of the aisle, and what could I do to help? And so I could get a piece in the New York Times and got enormous response back from it. And I hope helped a little bit to be a catalyst to what became the 21st Century Cures Act, one of the times when bipartisan is possible in a Congress where it doesn't happen very often anymore. Others have their own abilities and resources, and we need to activate them around the country.
Well, thank you, Norm Ornstein. That's a wonderful memorial to your son. You really sort of captured what he would have wanted and made it real.
And I'm not an Oregonian, but I love the state. I love the culture. I love the city of Portland. And we want to see Portland become a leader. We want to see Oregon become a leader for other states in the area. The resources are there. I think is there, but you have to overcome the inertia and time. It's past time. Thank you for what you do.
Way past time.
Yeah.
We're working on it, Norm.
Great.
Thank you so much.
Sure.